My fellow Guyanese, I am Dr. Ertanisa Hamilton, and welcome to today's COVID-19 update. The Ministry of Public Health has been focusing over the past week on the situation in our different regions. And today I have invited Mr. Javon Stevens, RHO of East Berbice Quarantine, Region number 6, which has recorded 1 positive case and death to date, to provide an update on the measures put in place to contain the spread of COVID-19. Here is Mr. Javon Stevens.
To date, the region has recorded 1 case of COVID-19. It was recorded in March of 2020. Unfortunately, we lost that patient. However, since then to now, some 2 months ago, 2 months passed, and we have not recorded another case of COVID-19. This is due to the fact that the frontline workers, the health workers at East Berbice Quarantine, is working beyond the call of duty to ensure that East Berbice Quarantine remains safe. A number of our programs implemented thus far are: 1, screening at all our health facilities across the region. That includes our 30 health center and health posts, stretch as far as Orias Separuta on the Quarantine River and extended to Platanka on upper east bank of Berbice. To note, all our district hospitals, that is Skeldon, Portmont and Maibikuri, we have screening facility there, primary screening facilities there. Also at Port Moran, we would have implemented and installed our mobile testing unit, where the general public, persons who feel that they may need a COVID test or may just feeling strange, different than the usual, they are invited to go and meet with the health staff there, and if needs be, a swab will be taken off of you and you get your results within a matter of 24 to 36 hours. At the Berbice River Bridge is our large screening point, because we know that's the main entry point to East Berbice Quarantine. On a daily basis, we find about 1,700 to 2,500 persons entering East Berbice Quarantine on average. So we have a team out there. The team is working 3 shifts per day between 6 to 6. That is the stipulated period where persons are permitted to travel as based on the COVID guidelines. Our staff is there every day from 6 a.m. to 6 p.m. doing screening to ensure that any person with abnormal body temperature or so is referred to a secondary screening facility. Thus far, it's proved to be very effective. It is helping us ensuring that we have no other COVID case passing through our fingers in East Berbice Quarantine. Also at our health centers, we've implemented hand washing facilities at all the centers across the region. And we are also doing a weekly television program to educate the public on preventive measures of COVID-19. We know today there isn't any vaccine for COVID-19 available, so we are asking the public to practice the basics. Social distancing is very important. We are asking that you maintain social distancing as much as possible. We ask that you continue to wear your mask where it's applicable, and we also ask that you wash your hands as much as possible. Wash it with soap and water, but in an instance where you don't access soap and water because of where you are, alcohol-based sanitizer is highly recommended. Once you do these things, we will be playing our part to ensure East Berbice Quarantine remains COVID-free. It is my vision that we in East Berbice Quarantine put all our efforts together, calling all stakeholders to work together for the betterment of this good region. Once we work together, we will remain COVID-free. Thank you.
Thank you, Mr. Stevens. Fellow Guyanese, you have just heard Region number 6's update and the scope of measures implemented since the region registered its first imported case and death back in March. The region has been taking all the necessary precautions to protect residents, and we wish to applaud their efforts because that region has not recorded another positive case within the last 2 months. Bravo! We continue to plead with you, fellow Guyanese, to follow the example of Region Number 6. The measures they have put in place are the very same you have been hearing from us each day. The difference, my dear Guyanese, is the high level of commitment that the residents of Region Number 6, East Berbice Quarantine, are demonstrating. They have been cooperating with health authorities. Why? Because they recognize the importance of adhering to the guidelines. They realize that COVID-19 can be beaten with the collective efforts and support of all. That self-sacrifice of complying and following the preventative measures is worth more than the money you expend on the beers on the corner. It's the gift of life, which is such a precious commodity. So I exhort all of you, bent on breaking the rules, to take a page from the book of Region Number 6 and ensure that you wear a mask, maintain physical distance if you are in public, but most importantly, that you follow the curfew and other measures that the ministry has in place. Residents of Region 1 and 7, and most importantly, those from the mining communities, we continue to ask you to be vigilant and provide the necessary information for us to be able to contain the spread of this disease in your communities. Those persons experiencing the signs and symptoms of this disease are asked to contact the hotline or the closest health facility so that you can access the necessary services. The same is being asked of all those who have been in contact with someone who was tested positive. We appeal once more to all other agencies and community groups to reinforce the guidelines to all residents. The situation in Guyana as of the 2nd of June 2020 is as follows. As of today, of the 14 tests done, there are no new cases. Our COVID-19 deaths remain at 12. The number of confirmed cases remains at 153. To date, the total number of persons tested is 1,672, with the total number of negative cases being 1,519. We currently have 70 persons that have recovered, 71 active cases in institutional isolation, 2 patients in the COVID ICU, and 25 persons in institutional quarantine. Now for the global report. Globally, the statistics according to the WHO are as follows. Total number of cases is 6,057,853, with 371,166 deaths. In the region of the Americas, the total number of cases is 2,817,232, with 160,514 deaths. We wish to remind the residents of regions 1, 7, 8, and 9 to desist from crossing the borders as COVID continues to strike viciously and take lives in Brazil. Let us continue to pray for guidance and protection for health workers worldwide, and especially our frontline workers who are heroically waging the war against COVID-19. We commend all those who are making a special effort to do their part in this crisis. and reiterate the need for all Guyanese to come on board. There is a silver lining behind this dark cloud that is hanging over us. But in order to see it, we must act wisely and stick to the guidelines provided. God bless you. Stay safe and healthy. Thank you.